We have a research we call the REACH Rural Telestroke Network, and we actually started this in 2002. And the reason we started this is we were getting called a lot from rural hospitals, from their emergency rooms, with patients that had a stroke, and they were wondering guidance of how to treat the patient. You know, at that point in time, and still, we only have one FDA-approved drug for stroke, and it's called tissue plasminogen activator. We call it TPA for short. It's a clot-busting drug, and it has a big impact when you give it appropriately. But to give it appropriately, you need a neurologist, usually on site. You have to see the patient, ideally, and you need to see the scan. So what we did is we developed a simple web-based telestroke system where we put cameras in these rural hospitals. We started with 2, now we're up to 17, almost 18 hospitals, where we basically, they give us a call, we go to our laptop computer, and we can be anywhere. I've done this from hotels when I've been traveling, do it from home, and we get on in a few minutes and we're able to see the patient, see the scan, interview the patient, interview the family, and then make a recommendation. So through this system, we've given TPA over 250 times in rural Georgia, where previously it was hardly ever used. Georgia is the biggest state geographically east of the Mississippi River. You know, we have over 130 hospitals, and many of them are very far apart. You know, a neurologist can't drive to them. So we just use the internet and the web to basically bring us instantly into a rural emergency room. If you think about it, a lot of people want to retire to the south, right? They want to retire to rural Georgia, but people over 65 and 70 are concerned about what the rural hospital is like. And people over 70 are at really increased risk for stroke. So previously, you would be in a rural community with a hospital that if you had a stroke, there wasn't really much to do. Now, you bring an MCG neurologist right to you within minutes.